CNA Practice Test questions and answers.
The CNA is caring for a client with a Clostridium difficile, C. diff, infection. Which personal protective equipment, PPE, should be used? A. Gown and gloves. B. Gown, gloves, and N95 respirator. C. Gown, gloves, surgical mask, and face shield. D. Gloves and surgical mask. Correct answer. A. Gown and gloves. C. Diff spreads through contact with infected feces. Gown and gloves are sufficient. The CNA is providing a back rub. Which technique is correct? A. Use deep short strokes. B. Heat lotion until hot. C. Use light circular motion over bony prominences. D. Chill lotion in the freezer. Correct answer. C. Use light circular motion over bony prominences. Skin over bony prominences needs gentle care to prevent injury. The CNA notices a red rash in a client's groin. What should be done? A. Apply corn starch powder. B. Apply moisturizing lotion.
C.
Ask the family what to apply. D. Notify the nurse. Correct answer. D. Notify the NNAAP. The rash must be assessed by a nurse before any treatment. Before assisting a client into the shower, what should the CNA do? A. Test water temperature. B. Apply lotion to feet.
C.
Have client remove clothes in the hallway. D. Turn water to the hottest setting. Correct answer. A. Test water temperature. Testing water prevents burns or discomfort. Lotion on feet increases fall risk. Upon finding an unresponsive client, what should the CNA do next? A. Telephone the family. B. Close curtains for privacy. C. Call for help. D. Page the doctor. Correct answer. C. Call for help. Immediate assistance is critical for unresponsive clients. Which precautions are used for MRSA? A. Droplet precautions. B. Neutropenic precautions. C. Contact precautions.
D. Respiratory précautions.
Correct answer. C. Contact precautions. MRSA spreads through direct contact. How can a CNA promote client autonomy regarding hairstyling?
A.
Ask the client their preference. B. Choose the style the CNA thinks is best. C. Use the quickest style. D. Limit brushing to salon hours. Correct answer. A. Ask the client their preference. Autonomy is supported by respecting client preferences. Why reposition a bedridden client every 2 hours? A. Increase comfort. B. Check on the client. C. Decrease fall risk. D. Prevent skin breakdown. Correct answer. D. Prevent skin breakdown. Repositioning reduces pressure ulcer risk. What equipment is used to transfer an immobile client from a chair to bed? A. Gait belt. B. Physical assist by one person. C. Contact guard assist.
D. Mechanical lift.
Correct answer. D. Mechanical lift. Mechanical lifts ensure safety for immobile clients. If unsure about a new client's transfer needs, what ensures safety?
A.
Ask additional staff to assist.
B.
Ask family to help. C. Use a walker. D. Use a mechanical lift. Correct answer. A. Ask additional staff to assist. Extra staff assistance minimizes risks. Families should not assist. After noticing non-blanching redness on a client's elbow, What should the CNA do? A. Apply lotion. B. Elevate the area. C. Lower the area. D. Notify the nurse. Correct answer. D. Notify the nurse. Non-blanching redness requires nurse assessment. How to promote autonomy regarding sleep. A. Follow unit schedules. B. Encourage daytime naps.
C.
Ask clients' bedtime preferences. D. Follow family requests. Correct answer. C. Ask clients' bedtime preferences. Autonomy involves respecting personal routines. A patient asks if you'll get help for a Hoyer lift transfer. Your response? A. No, I'm in a rush. B. Yes, I'll get help. Your safety comes first. C. I'll be careful since I'm rushed. D. I'll come back later. Correct answer. B. Yes, I'll get help. Your safety comes first. Patient safety is priority. Rushing risks injury. After bringing the wrong juice and being criticized by a nurse, how respond? A. Apologize and ask for kindness. B. Stay silent. C. Tell the nurse to get it herself. D. Ignore the nurse. Correct answer. A. Apologize and ask for kindness. Acknowledge the error, but address disrespect professionally. How to enter a room of a nonverbal hospice patient with family present. A. Start care without introduction. B. Explain care to the daughter only.
C.
Let the daughter provide care. D. Knock, introduce yourself, and explain care to both. Correct answer. D. Knock, introduce yourself, and explain care to both. Always treat patients with respect. Hearing may still function. A resident refuses a shower after 3 days. How respond? A. Insist to avoid trouble. B. Threaten to call family. C. Force into the bathroom. D. Respect their right and try tomorrow. Correct answer. D. Respect their right and try tomorrow. Patients have the right to refuse care. Explore reasons later. A resident cries and skips bingo. How respond? A. Skip it tonight. B. Your friends are there. C. There are prizes. D. It's okay, but would you like to talk? Correct answer. D. It's okay, but would you like to talk? Validate feelings and offer emotional support. A resident's son complains about care quality. How respond? A. Agree with him. B. Listen and suggest speaking to the administrator. C. Criticize the facility. D. Suggest moving his father. Correct answer. B. Listen and suggest speaking to the administrator. Stay neutral and direct grievances to management. A coworker leaves a computer logged in. This is A. Negligence. B. Defamation. C. HIPAA violation.
D. Malpractice.
Correct answer. C. HIPAA violation. Logging off protects private health information, PHI. Who does a CNA report to directly? A. Licensed nurse. B. Director of nursing. C. Administrator.
DCO.
Correct answer. A. Licensed nurse. CNAs follow the nursing chain of command. Before comforting a grieving patient by holding hands, consider A. Race. B. Cultural background. C. Mental health.
D.
If they're crying. Correct answer. B. Cultural background. Some cultures prohibit non-family touch. How respond if a dementia patient makes sexual advances? A. Report to the nurse.
B.
Ask them to stop.
C. Allow it.
D. Suggest privacy. Correct answer. A. Report to the nurse. Dementia patients cannot consent. Nurses must assess. When reporting a witness fall to a nurse, A. State facts only. B. Share opinions on causes. C. Chart it immediately. D. Call the family. Correct answer. A. State facts only. Incident reports require objective facts. A nurse asks you to give medication. What do? A. Deliver it. B. Refuse. C. Explain it's outside your scope and report.
D.
Ask the nurse to supervise. Correct answer. C. Explain it's outside your scope and report. CNAs cannot administer medications. Report scope violations. For a client with right-sided weakness using a cane, place it in
A.
right hand. B. Left hand. C. Dominant hand.
D.
Either hand. Correct answer. B. Left hand. Cane use opposes the affected side for balance. When should universal precautions be used?
A.
All client encounters. B. Open wounds present. C. Client has a fever.
D. Client cougue.
Correct answer. A. All client encounters. Universal precautions prevent infection in all interactions. Eliminating wrinkles in bed sheets helps. A. Prevent pressure sores. B. Ensure warmth. C. Reduce remaking frequency. D. Minimize blanket needs. Correct answer. A. Prevent pressure sores. Smooth sheets reduce skin pressure and ulcer risk. Which promotes client independence? A. Encourage self-bathing. B. Cut food for them. C. Schedule meals. D. Choose their clothing. Correct answer. A. Encourage self-bathing. Independence means supporting self-care abilities. Foley catheter care includes A. Keeping bag above bladder. B. Cleansing every other day. C. Keeping bag below bladder. D. Emptying only when full. Correct answer. C. Keeping bag below bladder. Positioning below bladder prevents backflow infection. How record 8 ounces of ice chips on intake? A. 8 milliliters. B. 240 milliliters. C. 120 milliliters.
D. 180 ml.
Correct answer. C. 120 milliliters. Ice chips count as half their volume. 4 ounces equals 120 milliliters. To respect a resident's decisions, a CNA should A. Suggest legal counsel. B. Actively listen. C. Refer to social work. D. Encourage family input. Correct answer. B. Actively listen. Listening validates autonomy. How assist a client grieving a friend's death? A. Distract with activities. B. Share your own loss.
C.
Ask if they want to talk. D. Say they're in a better place. Correct answer. C. Ask if they want to talk. Offering conversation supports emotional processing. Manipulation by a resident may include A. Reporting pain only to new staff. B. Lying to peers. C. Refusing medication. D. Eating alone. Correct answer. A. Reporting pain only to new staff. Manipulation often targets unsuspecting staff for gains. Approach and upset, yelling patient by. A. Touching their hands. B. Reporting to the nurse.
C.
Using a calm tone. D. Walking away. Correct answer. C. Using a calm tone. Calmness de-escalates distress. A resident with delirium may A. Cry over schedule changes. B. Hallucinate. C. Become weaker. D. Lose speech. Correct answer. B. Hallucinate. Delirium involves perceptual disturbances. Sleeping excessively plus withdrawing may signal A. Anger. B. Depression. C. Staff frustration.
D. Alzheimer's.
Correct answer. B. Depression. These are classic depression symptoms. After a cast application, assess. A. Toe color/temperature. B. Knee color/temperature. C. Pulse behind the knee.
D. Gros pulse.
Correct answer. A. Toe color/temperature. Toe changes indicate circulation issues. For stress incontinence, prioritize. A. Foley catheter. B. Frequent toileting. C. Fluid restriction.
D. Diurétique.
Correct answer. B. Frequent toileting. Scheduled toileting reduces accidents. After a fall, first, A. Assess for injuries. B. Leave to find help. C. Move to a chair. D. Roll onto their side. Correct answer. A. Assess for injuries. Injury assessment guides urgent care. Medical abbreviation for before meals and at bedtime. A. ACHS.
B. BID.
C. BM. D. BMAB. Correct answer. A. ACHS. Standard abbreviation, e.g., for glucose checks. On a dysphagia tray question. A. Regular orange juice. B. Mashed potatoes. C. Jell-O.
D. Applesauce.
Correct answer. A. Regular orange juice. Liquids must be thickened for dysphagia. Dark amber urine indicates A. Heart attack. B. Dehydration. C. Kidney stone. D. Impending death. Correct answer. B. Dehydration. Concentrated urine suggests inadequate hydration. Inadequate fluid intake risks all except A. Mouth sores.
B.
Bad breath. C. Skin ulcers.
D. Swollen gum.
Correct answer. D. Swollen gums. Dehydration causes AC. Swollen gums indicate other issues. A patient showering weekly reflects A. Need for facilities schedule education. B. Cultural differences. C. Family notification necessity. D. Depression risk. Correct answer. B. Cultural differences. Bathing frequency varies culturally. Respect preferences. Correct shaving step. A. Shave upward on the neck. B. Upward motion on the chin. C. Long strokes. D. Rinse blade every 2 to 3 strokes. Correct answer. A. Shave upward on the neck. Short, upward neck strokes follow hair growth. Expected diet for dysphagia. A. Pureed. B. Clear liquid. C. Mechanical soft. D. Regular. Correct answer. C. Mechanical soft. Soft foods ease swallowing. A Hoyer lift typically transfers from A. Commode to chair. B. Bed to bathtub. C. Wheelchair to shower. D. Bed to stationary chair. Correct answer. D. Bed to stationary chair. Lifts are for bed chair transfers. If a patient falls while ambulating with a gait belt, A. Lower them slowly using your legs. B. Lean forward to catch them. C. Yell for help.
D.
Let them fall. Correct answer. A. Lower them slowly using your legs. Proper body mechanics prevent staff/patient injury. A resident requests medical records. The CNA should A. Copy them. B. Refuse. C. Notify family. D. Provide release forms and advise supervisor. Correct answer. D. Provide release forms and advise supervisor. Residents have rights. Follow facility procedures. For a resident who prefers solitude, the CNA should A. Check constantly. B. Encourage them to ask for needs. C. Notify family.
D. Force socialisation.
Correct answer. B. Encourage them to ask for needs. Respect autonomy while ensuring access to care. A resident's room is cluttered. The CNA should A. Clean secretly. B. Threaten disposal. C. Help relocate hazards. D. Contact power of attorney. Correct answer. C. Help relocate hazards. Address safety collaboratively. Respect belongings. Two residents cuddle in a common area. The CNA should A. Separate them. B. Escort to a private room. C. Notify families. D. Allow them company. Correct answer. D. Allow them company. Residents have social interaction rights. A resident prefers nighttime baths over scheduled morning baths. The CNA should A. Help is needed at night. B. Report noncompliance. C. Insist on mornings. D. Refuse assistance. Correct answer. A. Help is needed at night. Accommodate preferences when possible. A staff member hides a resident's call bell. The CNA should A. Support the action.
B.
Give a fake bell. C. Promise hourly checks. D. Return the bell and report neglect. Correct answer. D. Return the bell and report neglect. Call bells are essential. Report neglect. How does cause of death impact grieving?
A.
No impact. B. Creates bad memories. C. Triggers past lost memories.
D.
None. Correct answer. C. Triggers past lost memories. Circumstances can complicate grief. For a dying patient grimacing in pain, prioritize A. Request nurse-administered pain meds.
B.
Do nothing. C. Adjust pillows.
D.
Ask the patient. Correct answer. A. Request nurse-administered pain meds. Pain management is critical in end-of-life care. Empathy includes A. Understanding without pity. B. Listening. C. Mindful communication.
D.
All of the above. Correct answer. D. All of the above. Empathy requires holistic sensitivity. After a resident's family member dies, the CNA should A. Sit with them offering support. B. Ignore it.
C.
Avoid emotional topics. D. Delegate to others. Correct answer. A. Sit with them offering support. Emotional support is part of care. A caregiver can manage stress by A. Exercising daily. B. Complaining about residents. C. Eating more. D. Reading. Correct answer. A. Exercising daily. Exercise reduces stress hormones. Post-mortem care requires
A. No supplies.
B. Bed bath supplies. C. Towels.
D.
All of the above. Correct answer. B. Bed bath supplies. Washing the body maintains dignity.